Hi guys, it's Dr. Salcedo, your conscious gynecologist. I'm so glad you're here and welcome to my first master class. Now, I created this class for a group of women called a Conscious Motherhood. It is a wonderful postpartum class that help women try to figure out what exactly happened in their pregnancy that caused pregnancy complications. It could have been chronic hypertension, diabetes in pregnancy, preeclampsia, growth restriction, problems with the placenta. All of these things have been associated with prediabetes and cardiovascular disease risk factors. I created this class with the help of the Nutrition Network and Eat Better South Africa in order to help women understand exactly what it is about their lifestyle and their body and what brought them into this pregnancy complication. But most importantly, it's going to help them with improving their risk for later. So I wanted to share this class. It's a 4 series class that I want to help develop and share with you, just so that you can help improve your future pregnancy outcomes. So, guys, let's talk about chronic disease. Let's talk about what that really means because so many women are in a different state of health than what they used to be even 20, 30, 40 years ago. Many more women are conceiving and they're pre-diabetic and they don't know. They have insulin resistance. Many women are struggling with abdominal obesity or abdominal weight, or sometimes they're struggling with peripheral weight all over their body, or sometimes they actually have fibroids, or they have high blood pressure, or they're diabetic already, and then they become pregnant, and then it leads to lots of other problems in the pregnancy. I want to describe what chronic disease really is. Now, what is chronic disease? It means that you have some sort of metabolic problem for more than 1 year. And a lot of times it requires medications like metformin or blood pressure medications to control, and it can sometimes limit your activities. So, examples of chronic disease are high blood pressure, diabetes, Alzheimer's, they call Alzheimer's type 3 diabetes, metabolic syndrome, eczema, all kinds of things that we think of as kind of normal things in our life. But when women actually get pregnant with some of these things, it can lead to certain pregnancy complications that are often hard to prevent. Now, what causes problems with chronic disease? Now, a big one is lifestyle. And unfortunately, even when we have the best lifestyle, there are certain other stressful factors that can play a role too. But by and large, in North America and Western civilization, Western cultures, lifestyle is a big thing. We're definitely not eating like how we used to eat. We're definitely not eating animal fat and proteins like we used to. We're not eating organ meats. Remember, when we were cavemen, we used to eat nose to tail. When we would sacrifice an animal, we would use all the parts of the animal, and our body has grown to rely on that. Modern culture and how we're eating with fast food, fast casual food, lots of starch, seed oils, these are all toxic things that cause inflammation to our blood vessels. But also inactivity, not creating muscle in order to support our glucose and to have a storage place for glucose. People also are smoking and vaping. Oh my gosh, vaping is so terrible. I had a woman in my office one time who came to see me for an IUD placement. She almost died because she was vaping just a few hours before and she went into respiratory distress. It caused crazy inflammation in her blood vessels of her lungs. She almost died, had to call 911. So anything that you consume into your body, inhale or eat, can really cause a lot of havoc at the lining of those blood vessels that support all of our organs. And another thing is excessive alcohol use. If you're drinking more than 1 glass of alcohol a day, for women, that might be too much and it impairs those blood vessels. Some of the most challenging C-sections I've ever done are on women who are alcoholics because they bleed so much because their blood vessels just don't know how to constrict. Sometimes it's also the biology. Now, sometimes we have these predispositions for certain chronic medical problems, and it's not like because you have these genes or these collections of genes, it doesn't mean that you're going to express this problem. That's actually a phenomenon called epigenetics. And epigenetics means that you have to be in the right epidemiologic setting in the right environment in order for those genes to be activated to cause these problems like hypertension, diabetes, obesity. Just because you have the gene doesn't mean that you're going to get it. It has to be turned on by the right environment. So I have a lot of families and patients that tell me, "Well, I'm struggling with obesity. Everybody in my family had obesity. Everybody in my family had diabetes." Well, that's sort of true. It's because families behave similarly and we're exposed to a lot of the same environments. But what we do know is that when those genes get activated by the right environmental trigger, then that's when you'll find the disease. Now, do you know of anybody that has these problems, that have these diseases, have these chronic problems that ends up developing problems with their pregnancy complications? A lot of us do. Now, let's talk about insulin. What is insulin? Now, insulin is a hormone that comes from the beta cells of our pancreas that actually produce a circulating factor that brings glucose into our storage cells, and that is our fatty areas, but also our muscle. But it also brings in insulin to it brings in glucose to every single cell in our body that requires glucose for its processing, its functioning. And so insulin's really important. But when we have too much insulin, from stress, because stress can also raise insulin, or from glucose and too much carbohydrates, it can actually cause a stress signal into our brain that will prevent ovulation. And that's because biologically, women, for better or for worse, were made to have babies. And if we have too much of a stressful situation going on, our body's going to be like, whoa, this is not the right time to have a baby. And we really need to be careful about this because we know that the biologic resources that are involved in conception and having a baby, it's easily a 3-year commitment for women. It's 1 year of having that pregnancy and 2 years of active childbearing, child rearing, breastfeeding, just to make sure that the baby can support itself. So that your body takes it really, really seriously. If you have too much carbohydrates or stress in your life, it's going to shut down the ovulatory mechanisms in your brain to prevent ovulation. But sometimes some people have these higher levels of insulin, and then that causes inflammation and that damages our blood vessels itself. And so all those blood vessels, the blood vessels that go to the ovaries and bring about a robust ovulation, the blood vessels that go to the lining of the uterus and cause a nice healthy area for the conceptus to implant. But if that conceptus is going to be received by the lining of the uterus that has too much inflammation, that conceptus is not going to achieve that implantation. And we know that women with hyperinsulinemia or polycystic ovary syndrome have a higher chance of miscarriage. Now, what is inflammation? Well, inflammation is basically when our immune system gets activated, and that immune system is there to help repair any damage that might be there. Now, imagine if when you get a paper cut, if you get a paper cut on your hand or on your finger, and usually it hurts for a second, it may even bleed. And then the next day, you'll notice a little bit of swelling. That's because your immune system has been activated to bring proteins and to take away proteins for in repairing your tissue, but also it brings in like white blood cells and macrophages in order to bring any potential exposures that shouldn't be in your skin and your system. It processes them so that you don't get an infection. But if I were to give you a paper cut every day at the same spot every day, your body would never heal. And when we're exposed to chronic inflammation from food, from stress, from smoking, from alcohol, from trauma, from anxiety, from any of these things, it will never allow your body to heal because it's always trying to repair itself. And that's inflammation. These circulating substances cause damage to our blood vessels. And your uterus is one big blood vessel. The pregnancy is a series of billions of blood vessels trying to form into a normal, healthy human being. Now, Remember, can we reverse chronic disease? The answer is yes. If we have a low carb, high fat diet that decreases the amount of sugar in our diet to decrease our insulin, by physiologic dogma, we know that our insulin level will go down and our inflammation will go down, our glucose will go down, and we'll be in a really healthy environment. Now, it takes time. It takes several months to years for your body to repair. But unhealthy things like fast food, carbohydrates, stress, all those things cause high glucose and high insulin levels, and that causes inflammation and leads to metabolic syndrome and chronic disease. Metabolic syndrome is like the beginnings of the chronic disease. And metabolic syndrome is when you have pre-hypertension, abnormal fasting glucose levels, high triglycerides, low HDL, and abdominal weight. If you've got three of those five things, you are definitely at risk for cardiovascular disease problems, and you may even be at risk for pregnancy complications. And we know that by reducing these factors, all those factors that are associated with pregnancy complications, if a woman had those problems during her first pregnancy, she can really improve her risk for the next pregnancy. So we know that if you avoid certain things that cause inflammation, like vegetable oils, and all those other inflammatory things I talked about, you can reduce your chronic disease. Now, how does this affect organs? Well, we know that people with metabolic syndrome and hypertension, diabetes have heart problems like heart attacks and atherosclerosis and bypass surgery of their coronary arteries. Lungs, we have problems with asthma and chronic obstructive pulmonary disease. Kidneys, we got kidney disease, like when we have too much protein leaking out of our urine, but also dialysis. But remember, the uterus is an organ just like any of those organs so that when women have problems with cardiovascular disease, diabetes, hypertension, it affects heart, lungs, kidneys, everyone accepts that. But remember, the uterus is an organ too. And if it receives inflammation, just like those other organs do, it's going to cause problems to the house of where the pregnancy sits. And if that uterus is diseased, you're going to have a higher risk for preterm delivery, premature rupture of membranes, cervical insufficiency, hypertension, diabetes, growth restriction. These are all well-known risk factors that lead to women's reproductive complications. Now, what about the uterus? As we were talking before, the uterus is a recipient to cardiovascular disease inflammation, like metabolic syndrome, prediabetes, high blood pressure. All of these problems can lead to the impairment of the smooth muscle of the uterus. Remember, the uterus is just one big blood vessel. And so if it's receiving these problems, we're going to get a higher chance of preterm delivery, high blood pressure in pregnancy, stroke, miscarriage, stillbirth, fetal growth restriction, diabetes, heart attacks, all of these terrible things. And it's actually a no-brainer now that we know that the North America, the United States, has one of the worst pregnancy outcomes in any of our modern nations. And that's because we have such a huge burden of chronic disease in this country. These are the big reasons why. Now, if we've got some pictures of the uterus here, and on the left is the picture of a uterus with a normal appearing placenta. Then we have a picture of the uterus that has a small placenta. It's called placental insufficiency. And that's because when that placenta was trying to implant to the lining of the uterus, it was receiving all this blood vessel inflammation and it couldn't grow into a healthy placenta. It turned into a small placenta that leads to stress on that placenta. And that's what causes high blood pressure in pregnancy because that placenta can't sustain the needs of the baby, the oxygen needs, the nutritional needs, and that's where preeclampsia comes in. So this is a funny cartoon that talks about preeclampsia physiology and why it is. It's because of this poor placenta is not receiving the oxygenation and the nutrients it's supposed to be receiving because of the poor implantation that happened. And that when that implantation was happening, the body was under chronic stress and inflammation that leads to dysfunction of those blood vessels and leads to organ damage that we know of as preeclampsia. So, what are the inflammatory triggers? Well, for so many people, it's a varying degree of many of these things that are on the inflammatory circle. And there's many more, but we know that ladies who struggle with weight, who have hypertension, or who have abdominal weight, or don't sleep well, or have sleep apnea or snoring, who are maybe struggling in a toxic relationship, anything with any toxicity will activate your immune system and cause problems with that implantation, as well as like the stuff that we already know about, like alcoholism and drugs and stuff and low vitamins. All of these things to some degree can affect women and impair their ability to have a normal, successful pregnancy outcome. And so the purpose of this small master class is to teach women about pregnancy complications and maybe how it is that they got there according to really robust science and data. And so that's why us OBGYNs really want women to come and see their OBGYN to help reduce their metabolic risk factors before they become pregnant, because we know that all of these things are associated with not great pregnancy outcomes. And we really, really want women to have healthy pregnancies. Women right now, they are receiving so much insult and inflammation, way worse than what our ancestors did. And that's why we have such poor outcomes in the United States, but also in general with pregnancy. So I hope you found this mini class helpful. There's going to be a few extra classes that are coming up, and I can't wait to see you at the next one.